Gentlemen, thanks for being with us today. Given the fact that you and your colleagues did publish this series of recommendations for the administration, you were so crucial to advising the administration in the early days and in the transition period. I do want to get both of your responses, and Dr. Emanuel, I'll start with you, to those comments from the vice president. The fact that it doesn't seem like, at least from those comments, your recommendations are being implemented, at least publicly being discussed, being implemented.
No, I wouldn't agree with you. First of all, I think the administration had a great strategic plan in January 2021. They executed well, and they're working every day, 6 a.m. to midnight, trying to execute. And we need a refresh of that strategic plan. We don't need to throw it out. We need to revise it, given the fact that the virus has changed and the circumstances have changed. And that's what we were suggesting. And I will tell you, they are listening and they are doing a lot regarding our recommendations. It is not true that they're not listening.
Okay, well, that is very promising to hear. Dr. Bright, what are some of those recommendations? How quickly can they be implemented?
Oh, absolutely. And I agree with the Dr. Emanuel and the vice president. Clearly, they have their hands full. There's a lot to take care of right now. As the vice president has said, we're in the middle of a surge, and the administration is focused on getting all the tools needed to address the surge, getting more people into the healthcare system and backup doctors and nurses and people to help manage those people who are hospitalized. And remember, in large part, those people who are being hospitalized and are dying are unvaccinated people. So we need to make sure that we don't let up our efforts in getting more people vaccinated. The other tools that we need to do is, and what we're doing with the surge, is think about how we're using our testing, the rapid antigen test, to help reduce the spread of this virus. Think about the guidance that we're putting about N95 mask and air filtration and ventilation, and making sure that we're bringing the power of those tools to help slow the spread of this virus. Our suggestions to the administration are that keep doing the surge, but while you're doing the surge, let's start envisioning what it looks like as we come out of this surge, and what tools we need to have in place to help control this virus, be aware of a next variant sooner than we were this last one, and make sure that we have a wall up that when the next variant comes our way, we can contain this and we won't have another whiplash panic happen in our country.
Well, Dr. Emanuel, you've said one guide is what we're willing to live with regarding the flu. Obviously, this is not the flu at this point. Although for the vaccinated, I wonder, is it? And, should we really still be focused, Dr. Emanuel, on trying to get people vaccinated? It would seem a year in that those who don't want to won't.
I don't agree with you. There are many of those people who haven't been vaccinated who are on the fence. And recent work in Montreal and Quebec have shown that there are a variety of ways that you can induce people to get vaccinated, especially people sitting on the fence. You got to be vaccinated to go to a liquor store. You got to be vaccinated to go to a marijuana dispensary, maybe even a financial penalty if you don't get vaccinated. There are a variety of ways that we can actually induce people to get vaccinated. That's the first thing. The second thing is the country's still at 1,750 deaths per day and going up. We've got to get below 300 or 250 deaths per day before we can really begin to think about talking about a new normal. We're nowhere near that level. And one of the consequences is, the vaccinated, they may be fine, but they're going to come into contact with people who are immunocompromised or young kids who can't get a vaccine. So we've got to get the incidence, the level in the population down before we can get into the new normal. And part of that is getting more people vaccinated. Part of that's wearing masks. Part of that is better indoor ventilation.